respect for the woman's body, her autonomy, informed consent, these things are not the norm. The idea that finally the woman only is the one who has to have the right to decide what happens to her body is not the norm in India. So if you look at what WHO says, C-section rate should be 10%, 15%. I think you can make a good argument for 20%. All of India and the private sector, the cesarean rate is 48%. Karnataka's private sector cesarean rate is 52%. In Jammu and Kashmir, Telangana and West Bengal, C-section rates in the private sector are more than 80%, that is 80. If you take 5 mothers, 1 had a C-section which was necessary, 1 had a normal delivery, and 3 of them had unnecessary cesareans. And if you look at data, you'll see that this C-section epidemic is much more in private hospitals.
Yeah.
It's happening in government hospitals, but much more in private hospitals because there's a profit element. And then everything is done in a feeling of an emergency.
Welcome to the Pregnancy Podcast by iMoms. This is an initiative to bring out unsung heroes and get best quality pregnancy insights to all the expecting couple out there. Today we have a very special guest, Dr. Janhavi Nilekani is with us. Welcome, Doctor.
Thanks, Ravi. Lovely to be here. Thank you for inviting me.
Pleasure is ours. Dr. Janhavi Nilekani, she's an economist and she's the founder and chairperson of Astrika Foundation and Astrika Midwifery Center based in Bangalore. She holds her BA in economics from Yale University and she also holds a PhD from the Harvard University. Astrika Midwifery Center in Bangalore started with a vision to make every birthing a joyous experience. So we'll find out a lot of insights from Dr. Janhavi, which are going to be very helpful for all the expecting couple out there. Janhavi ji, we are very curious to learn from you today and get all the insights from you. So first, would really love to know the vision of Astrika Foundation, what Astrika Foundation and Astrika Midwifery Center does.
Astrika as a whole, we have 2 parts. We do a lot of NGO work under the umbrella of Astrika Foundation and we run a boutique birth center in Bangalore, in South Bangalore, in a hospital called Vasavi Hospital. And Kumar is maybe out. So it's near JP Nagar for all you mothers out there. And we'd love to see some of you there.
You know in Bangalore.
So, you know in Bangalore, yes. So actually clients are in New Bangalore, but yeah. So really Astrika works towards ensuring that every mother has access to high quality, timely and respectful maternity care. And all these words are important, right? High quality care meaning care which is best for her and her baby. So not care which is done because of systems, processes, what is easy for the hospital, easy for the doctor, but really care which is consistently the best medical care for her and the child. Right? Timely means also on time.
Yeah.
There's no point giving good quality care if it's given so late that you can't, then it's not great from a health standpoint.
Yeah.
And respect, so that every mother should be treated with respect and dignity, that informed consent matters, that finally the woman's body matters and her choices matters. They should never happen to her. They should always happen with her. It is for her, right? So we work on all of these things at Astrika. So Astrika Foundation works in government hospitals and trust hospitals, low-income groups across the country. We do a lot of work in Uttar Pradesh, Madhya Pradesh, Karnataka, but generally all over India. Astrika Midwifery Center is a private center which I founded. It's like a startup which works on providing good quality healthcare to all of Bangalore's mothers.
Yeah, amazing. So we're also a fellow startup working in the same sector, and I'm really inspired by the entire Astrika Midwifery Center, how you have created and led, and I strongly feel there is a very big need for such natural birthing centers. So I just wanted to ask one question: is every founder has their own story, like their own motivation to start something new? When the city is already filled with so many maternity hospitals, many NGOs that are trying to do the same work. What is your own inspiration starting Astrika Midwifery Center and Astrika Foundation?
When I was pregnant in 2016, at the time I was a student at Harvard in the US and I was doing my research fieldwork in Bangalore. So I was going up and down in my pregnancy and the quality of healthcare I was getting in the US and what I was getting in Bangalore, the difference was so stark, I was just shocked. Because you expect low-income groups and all to not getting such quality of healthcare in India, that's understandable. But that the quality available to the wealthy and the English-speaking elite was also so poor, I was very surprised. Right. Because you don't see benefit. Yeah. The quality of education is fantastic, be it IB and GCSE. Whether it's movies or consumer goods or holidays or fine dining or housing, all of those things, Bangalore life is at par with what you find abroad. But in healthcare, it was distantly poor and I was shocked by it. So I searched a lot for hospitals in Bangalore which were giving international quality of care. And by that, I mean outcomes. I don't mean how, see, urban hospitals often are judged by how hotel-like they are.
Yeah.
And because the sentences are hotel-like and because consumers cannot judge. I don't know what is good healthcare, I know how it looks. And they're competing on them and those dimensions are fantastic. But the quality of the actual medical care, there is very little. Consumers are not judging. And one of the things I really believe is that women have to stand up and demand better. For myself, I did demand better. I insisted on finding a quality of care comparable to what was in the West. And finally, I went and had my son at a hospital called Sanctum in Hyderabad, founded by Dr. Vijaya Krishnan. Fantastic for all you Hyderabad mothers out there. I can't say good enough things about it. So I got the work I wanted, but I did not feel that, every mother in Bangalore or Delhi or Bombay should not have a child like this. Every metro area ought to have good options. So it was that inspiration that other Bangalore mothers should not have to go to Hyderabad that I founded Astrika Midwifery Center.
Very inspirational, good to know. Something that came out from your own personal observation. And one thing I really liked is, you said education is great, all the whatever we are consuming as consumers, all the consumer companies, the quality is very great, but when it is coming to something very basic like a childbirth, if the quality is so drastic, it's very shocking. But today people seem to be fine about it. Like you saw how it is happening in US and compared it with India. To put things in perspective, what are the outcomes are you talking about? C-section rates, episiotomy, all these outcomes you've talked about. What are the numbers here in urban India versus US or other developed countries? And what is a drastic difference if you can throw light on?
India is a land of many parts. In some parts of the country, you have the problem of what the public health community calls too little, too late. There is not enough care, there is no nurse, there is no drug. That is one problem which everyone is aware of. In metro cities, that problem is largely solved. But childbirth is safe. Mother and child usually are quite safe through it. Unless there's some genuine medical concern, they will be typically safe. But urban hospitals are really lacking on two dimensions. One is that respectful maternity care, respect for the woman's body, her autonomy, informed consent, these things are not the norm. The idea that finally the woman only is the one who has to have the right to decide what happens to her body is not the norm in India. That is still seen as a very Western concept. But more basically, there is an abundance of too much too soon. Too many cesareans, too many inductions, too many episiotomies, too many augmentations. And all these are not good for the health of the mothers. Of course, all the babies, all the next children. Younger siblings' health is affected by the older sibling being born by cesarean.
So that's a powerful insight, Dr. Janvi, and inspirational to know your own personal story and intent behind changing the ecosystem. Just to get more clarity, you mentioned that there's a stark difference between the quality of healthcare, especially in this segment, in US and in India. Can you deep down and put things in perspective? What are the rates of outcomes there? What are the cesarean rates there, here? And what actually is different in the care today?
Definitely. So, in metropolitan India, your Bangalore, your Mumbai, NCR, etc., definitely childbirth is safe. That's not true of all parts of our country, childcare and so forth. But in urban India, definitely I'm not saying there are doctors, there are hospitals, there are drugs. But clinical outcomes are not as per global standards at all. And the most stark example is C-section rates. So if you look at what WHO says or other prestigious research, C-section rate should be 10%, 15%. I think you can make a good argument for 20%. But not more than that. Now, what are India's rates in the private sector? All of India in the private sector, the cesarean rate is 48%. Karnataka's private sector cesarean rate is 52%. In Jammu and Kashmir, Telangana and West Bengal, C-section rates in the private sector are more than 80%. That is 80. That means out of every 4 surgeries, 1 was needed, 3 women didn't need it. I have heard my own midwife used to joke that in Calcutta, the only way to have a normal delivery is that the baby falls out. Otherwise, everybody gets a cesarean, whether they need it, don't need it, whatever. And that is not good healthcare. A C-section is a major abdominal surgery. It causes bad health out. I mean, it can be life-saving. Don't get me wrong. I am not even natural childbirth. I very much believe in medications and C-sections when needed. But we don't go and do heart surgery for no reason. Yet we do C-sections for no reason. It is utterly normalized. So to give some few more examples, right? Episiotomies. 20-25% seem to be good numbers. There isn't strong data on it. For first-time mothers, there's one study in tertiary hospitals in India that 85% were getting episiotomies. But from interviews and what I've spoken, it seems to be closer to 99% of first-time mothers. First-time mothers are given episiotomies is the norm. That's not great for the health. There's an abundance of evidence that is not good for the health of the mom. Staying with C-sections, if the number should be 20%, and it is 50%, 60%, most Bangalore hospitals seem to be at 80% from what I've spoken to doctors, I've spoken to management, I've spoken to nurses. First-hand observations, C-section 75-80% are the rates. So majority of women are getting unnecessary cesareans. Out of every 4 C-sections, 1 was needed. If you take 5 mothers, 1 had a C-section which was necessary. 1 had a normal delivery, and 3 of them had unnecessary cesareans. That means more than half the time you're getting a bad health care outcome. Now, what does a C-section do? It is a lot more recovery for you. There are all kinds of recovery in that pregnancy. It's not as good for the child. Now, of course, if something is going wrong, it's good for the child. But if it's otherwise healthy, low risk, it's not as good for the child. Be it allergies, asthma, various risks go up with the C-section. Various risks go up for the mother with the C-section. And risks go up in every future pregnancy. Right? So, you're creating harm on not only the mother and this child, but all the future children. And that is taken so casually, it's so normalized. There's no thought also before doing it in many settings. I'm not saying every doctor, every hospital, but very often it's treated like, what is the big deal you're making so much about a C-section versus normal delivery? The other major challenge in metropolitan India is that respectful maternity care, where the woman's consent is taken, is not happening. And by consent, I mean informed consent. Definitely doctors and hospitals will make sure the lady is signed on a piece of paper before they go to the OT. That is their regulation, that is compliant, that is NABH. But it is often what I call fear-based consent rather than informed consent. How is this consent taken? If you don't listen and you take this decision, that if anything happens to baby, risk has to be on you. If you agree, that's fine, I don't have an issue. I have heard so many stories like that. That is not informed consent. It is utterly and completely fear-based. You put fear in the woman, her husband, her mother-in-law, her father-in-law, her own parents, her sister, and everybody's a victim. Of course, in that moment, they're like, we cannot take any chance with the grandchild. So they say, okay, informed consent means giving genuine information to the family about the pros and cons of any intervention. And then with that, and that doesn't mean don't do this, maybe it's needed. But it's only with that truthful, honest pros and cons you explain to the patient and her family. Take the consent and then do surgery. That is informed consent, and that is not happening in urban Indians. I know too many stories. You know too many stories. If you don't listen to me, nothing. And then everything is done in a feeling of an emergency. Mothers are not given time to reflect. I've heard n number of times. So I went for a consultation, looked at scan report. They said it's an emergency. That's it. They called me. Then we did a cesarean. Then they're there. But was it truly an emergency? Now, I cannot give any comments about individual situation. But when we know that in India the C-section rate is much higher than medical protocols, then obviously most were not emergency. How will you end up with such high numbers? At the national level or state level or city level, they're not mostly emergencies. But for any individual family, they don't know then they have been an emergency. You cannot take the chance. So that is an atmosphere of quite a bit of disrespect for women's autonomy and their bodies.
Though that's unfortunate, many organizations like Astrika and, many great people like you are creating an impact. So let's hope the situation changes soon. You mentioned about the pros of a natural birthing. Of course, if it's needed, if there is no medical intervention required, having a natural birth has a lot of pros. There are so many researches I also read which says that, when a baby gotten that opportunity to pass through the mother's birthing canal, they will have essential microbiomes, and C-section can put risk of having respiratory diseases or let's say lactose intolerance at a higher risk for the baby in the future. But what are the reasons, do you think? Still, doctors are obviously aware of these researches and these consequences. But why do you think still we have such a staggering number at a systemic level?
Yes, there are several reasons for India's sky-high C-section rate. I think one is very simple reason is it has now become normalized. Nothing, who do you know? When I gave birth, I was the only person I knew in India who had had neither a C-section nor an episiotomy. Everybody I knew had some type of cut and stitches of some type. Usually C-section, but otherwise episiotomy. It is the norm. So no mother is questioning, no family is questioning. Now once things are normalized, it's very easy to go into that equilibrium.
Yeah.
So one is that is happening. It's just C-section is the norm. What's the big deal? That's how we have a baby.
Yeah.
That is a big reason.
Yeah.
Cultural acceptance has been very, very high. You don't see that in the West. That they will not culturally accept major surgeries for everybody. But that has happened in many middle-income countries. Definitely, there is a profit element. Let me be honest. One is that C-sections are often charged higher than mortality births in the majority of hospitals.
Right.
And if you look at data, you'll see that this C-section epidemic is much more in private hospitals.
Yeah.
It's happening in government hospitals, but much more in private hospitals because there's a profit element. So one is a plain old revenue element, that prices are kept higher for a C-section, so people make more. And you have to stay along with the hospital for a C-section, so that also is a revenue generation. But the cost structure is much less for hospitals with a C-section.
Yeah.
So, take Africa Midwifery Center. We promise you that we will try everything for a safe normal delivery. Now that word there is safe. 24/7 we are ready for an emergency cesarean. We will never let health be compromised. But if you have to be ready for an emergency cesarean 24/7, think of the structure. We pay obstetricians 24/7, midwives 24/7, nurses 24/7, pediatricians 24/7. And anesthetists 24/7 are available at Africa Midwifery Center for an emergency cesarean. But that is a very high cost structure. Now suppose you're doing high rates of C-sections. I know what's happening all over the country. I mean, these OTs are not running at night. Labor rooms don't run at night. If you give birth vaginally in the day, okay, great, you had a normal delivery. Otherwise, you're on 8 p.m., midnight, and now then you finish off everybody with a C-section. So you don't have to pay any of these people at night.
And also it can be scheduled and very less time required.
So your much less medical staff are needed if you have a high C-section rate. That is sense. So therefore profits are much higher with that model. There's a convenience model. If you have a lot of scheduled C-sections or a lot of labors which are given oxytocin to be faster so that you have a quicker birth, then it is very convenient for hospital doctors and everybody, right? You can sleep. Obstetrics can be a day job if you have enough C-section rates. It's not possible if you're doing it very ethically. Then obstetrics is a 24/7 job. Ganesh, but Shatriyuti, that's the whole doctors are available at Africa. That's not happening at UM. I think there's been a fair amount of skill erosion among the medical community. 30 years ago, the level of comfort they had with vaginal births, that has honestly gone down. People can do easy normal births, but many doctors in many hospitals are not confident in the complicated normal birth. They would prefer a cesarean over a slightly difficult normal birth. Even things like vacuum faucets, the skill is eroding. A lot of people don't do them anymore. But those are all good medical interventions, which doctors should have in their toolkit ready. There is at least some pressure from families. There is. Mothers are scared of labor, and unfortunately C-sections are offered as a pain relief method, which I really don't believe in. If you need pain relief, then offer an epidural. That's what we do at Africa Midwifery Center. We say that no C-section at Africa should ever be because of profit, convenience, impatience or pain relief. If the pain is too much, go for an epidural. I'm not saying don't take pain relief. That's what I said. That neither me nor Africa believes in natural childbirth. It's not the point. Don't suffer the pain, that's okay.
Yes.
But don't go for major abdominal surgery as a pain relief method. We will always give an epidural first. And then others are fine with an epidural, then we intubate. So certainly fear of pain is one. And people have heard only bad birth stories, so they are very traumatized. They're carrying all these bad stories around, so they come in only with a lot of fear and hesitance. And one factor is this pressure for Muhurats, pressure for birth sites and auspicious times, which again I don't really agree to that. That the health of the mother and child should not be compromised for auspicious times and dates is my personal belief. That is up to families. But definitely we see, there is a societal factor that the child should be born at an auspicious time. And that is often put ahead of the health of the daughter-in-law and the grandchild, which I don't personally believe in.
That is a very interesting perspective, Dr. Janvi. Thanks for sharing. As a healthcare leader, other side of the argument, today we have about 100,000 doctors and 30 million pregnancies. About 26 million to 30 million pregnancies happening on an annual level. Do you think, I mean, there is a systemic burden once, and there are multiple other factors because of doctors are also saying there are litigations on doctors. Doctors are now quite aware. Obstetricians are one of the most sued professionals in healthcare system. So there are multiple other sensitivities involved from the healthcare provider side also. What do you think role of that on the larger picture which you have just shared?
So that this balance is creating a very one-sided situation for doctors in terms of for them what is safest from a medical legal perspective is always rural C-section.
Right.
Right. They are also at the end of the day they can also feed their families. No, they have their personal constraints, no doubt.
Yeah.
There is a shortage of obstetricians, but I would not quite agree. See, the shortage of obstetricians is not happening at places with high C-sections. There, the high C-section is happening
Correct.
enough
I'll
for
go next, yeah.
obstetricians.
Yeah.
But there is a culture of individual practice.
Yeah.
That each doctor is by herself responsible for XYZ patient. One expectation that families put on doctors, which I feel is very unfair, is they expect the doctor to be, who they have been seeing throughout pregnancy, to be personally present at their delivery. This expectation is coming from families. If that doctor has been present and she also has to sleep there, she also needs leave, she has to be with her children, then of course she has to juggle things so that deliveries happen and so on so tight.
Right.
So, no doubt, I think one of the ways forward is group practice. I really believe in that a team of doctors work together so that they are covering 24/7 duty and at the same time each one has time to themselves. That's what we follow at Astika Pharmacy Center. That is certainly very needed. And I think it's important to have well-trained nurses and midwives. That's another thing we work a lot on at Astika.
Yeah.
To support the doctor so she's not by herself trying to do so many things.
I totally agree with you saying a whole system reform is much needed for both for the greater good of healthcare providers as well as the consumers. You have given very good insights on the outcomes. Now, as a expecting couple, what would you advise an expecting couple so that they get the outcomes they desire? For example, you mentioned out of every 5 couple, 3 unnecessary C-sections are happening and 1 C-section is a lifesaver, which is essential. 1 normal delivery is happening. Out of these 3 women, most of the women might not want to go for that C-section. It's a part of the system which they are catered to. So what should they do to ensure if they want a natural, safe natural birth, that they get it?
I think 2 things are very important. One is I would strongly recommend going for childbirth education classes and learning a little more about birth.
Yeah.
If you don't know anything, it's very hard to do anything useful or productive or actionable, right? Even a little bit of learning will take you a long way in terms of getting the outcomes you're seeking. I'm sure Imam Zoli would have a lot of recommendations for childbirth education classes, and it will be easy for everyone watching this podcast to find the right partners. The other thing that is I really recommend to expecting couples is to carefully select your doctor and your hospital. In every urban city, there are some doctors, some hospitals who are doing good work, who are trying to provide best of care using various methods.
Right.
Find them out. Go to Facebook groups like Informed Birthing India. Follow, thought leaders in the space like Dr. Vichar Krishnan this one, and follow me also. But whoever, a lot of people will give good recommendations. There are these birth networks in every group. Coimbatore Parenting Network, Coimbatore Parenting Network is there. Bangalore Birth Network is there. Follow doulas and childbirth educators. Often if you go ask a doula or childbirth educator, they'll have very good recommendations. This is true in all the cities, Tier 3, Tier 4, etc. Anupama Briksham is one.
Yeah.
There are quite a few people who are influencers and thought leaders in space who are giving very good information. So I would say seek them out, pay some attention to them, ask freely. And look at, if you know people who have got to certain hospitals, go ask them their outcomes, ask very frankly.
Yeah.
And don't ask only was it generally good, was the nurses good, like what was the health outcome you got over there? Was that at the level you expected? Let's say cesarean happened. Did you feel it was needed, justified, or did you feel like this is the emergency or this is going too slowly and they took you to the OT? And even if a C-section happened to your cousin, your friend at some hospital, what was the situation? So read birth stories, learn birth stories, speak to people.
Yeah.
I think there's a lot of community all over India trying to connect expecting mothers with good facilities.
Absolutely.
So seek those out.
Yeah, that's a very beautiful advice. On that note, Bangalore folks, we are fortunate to have Astarika Midwifery Center in our own city. So for good healthcare, experts and better outcomes, you can seek that out as well. So Astrika is doing such a good job, but unfortunately, folks who are not in Bangalore, they can't avail it. What other centers across India do you have any recommendations?
Definitely in Bangalore, I still have to say Astika Veterinary Center. If you all are watching and you're Bangalore based, please do visit us.
that as well.
You second that. Thank you. Like in Hyderabad, both, so Sanctum Birth Center, where I had my baby with Dr. Vijaya Krishnan, I can vouch for like anything. I had the most best of birth experiences, and everybody says that. For Nanas Foundation is doing great work in Hyderabad. Priyanka Idifra is a fantastic center in Kochi. Dr. Amit Durandar is doing very good work in Mumbai. In NCR, in Delhi, both Sitaram Atya Hospital as well as Dr. Urvashi Sehgal have got a lot of good things. And I think in most metros, still if you search, these are the ones I know off the top of my head, but most metros, if you search, there are some doctors who are doing good work.
Yeah, that's quite interesting. So there are many common questions that expecting couple do have before birthing. I just wish to ask so that we can get your perspective also. I heard Astrika does a lot of VBACs as well, vaginal birth after C-section. It's a very common norm that is existing, which we are also seeing that I have an IVF conception, I have to go through only cesarean section, or I had a previous cesarean section, now the current delivery should also be cesarean section. So what is your take on it? Is it possible if they wish to go for a safe natural birthing? Is it possible, and how they should be preparing?
Yeah. Even if you have had a previous cesarean, you can still have a normal delivery with the younger child. A vaginal birth after C-section is possible, and I strongly recommend that almost all women should at least try. The success rate for a VBAC is definitely lower. So for women at Africa who try for a VBAC after one cesarean, the success rate is 50 to 70%. So some 30 to 50% are having a cesarean. But that is still lower probably than in most hospitals for a first-time mother. But in Africa, for a low-risk mother, the success rate of vaginal birth will be almost 80-90%. Definitely, the chances of a C-section are higher if you have a previous cesarean. But until you try in that moment, you will not know if you need a cesarean or not. So we recommend trying a VBAC to all mothers. People come for us for VBAC. All over the city, people now come to Africa seeking a VBAC, and most of them are having a VBAC. It is definitely higher risk, but it is not so high that you can't try. I would say if you want a VBAC, few things, look for a center that's experienced at VBACs, so that they are mindful both of how to try for a good normal delivery and at the same time how to be safety cautious and go for a repeat cesarean when the situation indicates. So even for us, it's taken trial and error. This year we have been much better than last year, for example. So look for places where they have a good rate of VBAC. Those are places where your chances are good and where they will be safe. And from your own end, definitely I think being fit, keeping up with exercise, diet, fitness is a big one. Getting childbirth education, maybe seeking a doula, seeking support systems for a VBAC, connecting to people who previously done a VBAC, all that really helps.
That's a very insightful advice. I really liked your last point as well, and it's very hopeful also for all the mothers. This whole statement which you made, those who are seeking for a VBAC. Thanks for sharing that. Another important area I wish to ask you is, we came to the doctor. Doctors are fantastic. Let's say people are fortunate to get to a very good birthing center. They're getting about 30 minutes, 1 hour of care once in every month. But they're spending times at home. Right? The rest of the time at home. How should be the 9 months of preparedness for the mother? Today we are living in a life where pollution is very high, sedentary lifestyles. Most of them still choose to work till the end, and nutrition is not of a great quality in general. So what areas, stress levels are also quite high. What areas a expecting couple should be focusing on for the better birth preparedness in this entire 9 months? Which areas you would really recommend?
I personally recommend being prepared and lifestyle aspects on several dimensions. One is being emotionally ready. That also matters. If you're carrying a lot of anxiety around the birth, honestly that affects outcomes. Same stress, but I think the stress thing is very nuanced where people say don't be stressed, you're pregnant and you only feel more stressed because no one will help you relieve your stress and you're stressed that you're stressed. So I think definitely, again I would say there are a lot of people, whether it's prenatal yoga or doulas, childbirth educators, a lot of people to help even on the emotional readiness, and I really recommend those services. Nutritionally, see, people often choose to not eat healthily, but I would also say more than ever in the human the history of humanity, you have the best options for nutrition. Be it the range of fruits, range of vegetables, range of options, even chicken, places like Bangalore, the quality of healthy produce available is also fantastic. So I think nutrition, there are abundant options. You have to just make thoughtful choices. You just think a little cautiously, but there's no shortage of options. Sedentary lifestyle is having a very big impact. And one thing I find is that, women, because they're so conscious of being non-sedentary during a pregnancy, are actually, even when they're quite diligent about the walking, the prenatal yoga, etc., they still are not paying very much attention to what's happening the other 23 hours of the day. But good posture while sitting, good posture while sleeping, moving around in between that, being a non-sedentary lifestyle doesn't mean you're 1 hour of exercise and 23 hours of sitting at a desk or sleeping. It is also about being active in between. But again, this is quite resolvable. My colleagues have apps where, every hour you walked around on your phone. So I think being conscious of your 24/7 sedentariness is something I would definitely strongly recommend. Again, information readiness I see is very important, that you should be ideally look for childbirth education classes, or at least through apps or subscribe to services, or read books or follow influencers on Instagram. Even if you don't go full class, I would still recommend learning some things about pregnancy and birth as a way to move ahead. So all these things put together, usually women who try all this can be much more ready for childbirth, whatever. And even if they then have a C-section, it's not because they have not done anything. They've at least tried their part. Beyond that, maybe they can't contribute.
So today there are so many women, those are coming to Astrika Midwifery Center. What are the common fears or concerns among them regarding birthing and pregnancy? What are you commonly observing?
Oh gosh, random mothers seem very scared. They have a lot of concerns and fears about pregnancy and birthing. There's a lot of concerns about daily life. Will it harm my child? What am I eating? What am I exercising? How am I sleeping? Am I too stressed or am I working? Everything about daily lifestyle feels very frightening. But babies are resilient, bodies are resilient. Yes, healthy lifestyle matters, but any one episode of something going wrong, you felt this, that, usually nothing will happen. So I think people are carrying a lot of stuff. Can I go for a movie theatre? By and large, pregnancy is not an illness. Pregnancy is a part and parcel of a woman's life. Don't perceive yourself as sick. Sure, be a little cautious. There are some precautions. But you're not ill. You're going to become a mother. So I think carrying that attitude with you is important. A lot of questions about will I be able to handle the pain in the normal delivery. We always reassure them at Astrika Midwifery Center we are not a natural childbirth center, we are an allopathic hospital. We are trying to have normal deliveries, high rates, but we are not a natural childbirth center. We are every pain relief method, from opioids to laughing gas to epidurals. So we do reassure them that there is abundant pain relief is available. So definitely a lot of fears around that. I think people spend so much time preparing for pregnancy and birth, they forget to prepare how to look after a newborn. And then the baby is born, they're like, oh my god, sleep, diapers, swaddling, feeding, breastfeeding. People don't prepare enough on breastfeeding. So I feel like this weird thing where they're too worried about some things and they're not worried enough about certain things. And learning breastfeeding at least a little bit in pregnancy itself is something I recommend.
And I resonate with this too much, thinking about this 9 months and too little preparedness for postpartum and newborn care. Even many families also, they focus a lot on the mothers during their pregnancy journey, and the entire focus shifts on the baby right after the birth. So glad that you brought it up. When you said a lot of fears about seemingly small things for the experts, I recently, one of my friends said he went to UK and he saw a 5-month-old pregnant lady, with a visible belly, running on the fields, and he was suddenly surprised. This never happens in India, right? So even physical activity, moving, everything, we get very conscious about. There is a line between being conscious and being anxious. So do you think as a society in India, we take a lot of fears about pregnancy? Will it be okay? Will it be okay? Will it be okay? If yes, what do you think the reason might be?
I think as a society, we are extremely fearful of pregnancy. That's coming from a long history of, maternal mortality rates being high, but is not perhaps very well suited to the current era. I have had, questions I would not even have thought of others asking, like, can I go for a movie? And I'll be like, of course you could go for a movie, and then after I will be back off, you think, if you're going to really ask me, then okay, COVID risk will be somewhat higher in a movie theatre. People worry about a lot of things, all kinds of obscure worries. Can you drink coke? Can you go in an auto rickshaw? A lot of things are okay. Like, it is not a disease. Your body is resilient, your child is resilient. I'd like to touch specifically on the fears around exercising. As a culture, we have this very strong belief that pregnant women should rest. But it doesn't make sense, because think of it evolutionarily. We as humankind were evolved to be tribal lifestyle or to be in the fields. Now, for such people who, if they are morning to night, they are working in fields, or they're hunting and gathering, or looking after childcare, or the typical life in which humanity evolved. For them, I can understand that society would have evolved to say that let the pregnant mother not be participating in as much in the agricultural work and so forth. She should get rest. In that setting, sure, rest is good. We have taken that same attitude and brought it to modern, urban, sedentary lifestyle. And you're doing nothing all day, the last thing you need is rest. In a desk job lifestyle, no pregnant woman needs more rest. Unless it's specific instances the doctor may tell. But in generally, no. So being active is actually one of the things that there's a huge amount of fear in Indian society, which is quite wrong from a health perspective.
Right.
Being active, being fit is definitely good for you and your baby, except if you have some specific condition your doctor may have told you.
Yeah, makes sense. And you researched a lot when you are personally going through this journey. Would you like to share your personal experience during your pregnancy journey and give some insights to all the audience from that?
I put a lot of work into my own pregnancy. I think in my whole lifetime I have not been as fit as I was when I was 41 weeks pregnant. In fact, the second best is when I went on a Himalayan trek, is when I was 16. That was my second, literally pregnancy was top fitness. So definitely I think I put a lot of effort into it, which paid off really well. In my birth, for example, I had no stitches, I had no C-section, no episode. I didn't have any tearing either, because I had done perineal massage and things to prevent tearing. So definitely preparedness makes a difference. Having said all that, I feel that what I feel I did best was choose the right place.
Yeah.
And that this, often what urban Indian couples are doing is like looking at the trees and ignoring the forest. However much yoga you do, however much you eat nutritiously, it makes no difference if you go to a place with a 90% C-section. It doesn't matter what you do.
Yeah.
It has no impact at all. If you go to a place where the norm is to present friendly, you may as well not exercise. You can exercise for general health, but it's not going to matter. So the forest, picking the right team, the healthcare team, is actually much more important than how much have you invested in exercise.
Makes totally sense. The end game is with your healthcare provider, and what quality of care that is giving can totally make an impact. One last question. There are so many expecting couple watching this podcast. What is your final, one good message which you want them to take away from this podcast?
I really want Indian women to believe, and Indian families to believe, that birth can be joyful, it can be positive. You're not ill, this is a moment of joy. You can seek out good quality of care. Yeah. I personally think nothing will change in India till women demand better care. The moment we as a community, as women, demand better care for ourselves, hospitals will sort themselves out. It will happen. If you demand care, and often we so often in situations that the mother wants something, but she has no support even in her own family, from her husband, her in-laws, her parents. They don't go to the nearest hospital. All this stuff about quality of care, I don't believe in it. But stand up for yourself. It is a once or twice in a lifetime moment for you. Women's empowerment starts at home. From what you are saying, your husband, your mother. If you want something which is for your health and your child's health, be strong. It is the moment you're starting motherhood, right? You have to be strong for your child also. So if you're convinced of something and you feel you found the right things, you should pick what course is right for you, for your pregnancy, because it's the start that you are never looking after another person's life.
Yeah.
And you have to yourself be strong.
Thank you so much for that beautiful message. So stand up for yourself, demand a good care, and have a joyful birthing experience. And also, thanks Dr. Janvi for stressing so much on the preparedness, getting right information, right? And having the entire 9 months prepared. It was really, really insightful having you on this podcast, and we thoroughly enjoyed this conversation. And I'm pretty sure that the folks who are watching this got tons of takeaways on the things which they would never have imagined. So thank you so much.
Thanks so much, Ravi.
Yeah.
Thanks for having me.